Been let a baby first stabilize in terms of all their body systems, and then when the baby is stable, and that is when the parents or the family would come in to do kangaroo mother care. But look, here we are saying immediately after birth we can start kangaroo mother care, and so many other small actions that have been studied to show improvement in both mortality and morbidity. Welcome to the Pediatric Voice. This week we are discussing the small actions that can have been seen to create big impacts in the improvement of the morbidity and mortality of our babies that are born too soon. And I am your host, Dr. Helen Namsoke. But first, before we dive into the discussion, let's look at the guest.
Dr. Judith Lubega, pediatrician, Kawempe National Referral Hospital, Special Care Unit, holds a bachelor's degree in medicine and a bachelor's degree in surgery and a master's of medicine in pediatrics and child health.
Welcome to the show, to the Pediatric Voice, Dr. Judith.
Thank you so much, Dr. Helen. Thank you for inviting me, and thank you for having me.
Yes, our viewers out there would want to learn from you. You know, this week we are celebrating the World Premature Day, and as you've had a theme, small actions, big impact. And on the Pediatric Voice, we are talking to the parents out there, to our guardians, to our caretakers. So we would want them to be involved. We don't want them to miss, because so many of them have had a premature, know a friend, a relative that has had a premature, you know. And if we feel if they got involved into the theme, they would, you know, be active and help. You know, it takes a village to raise a child.
It takes a village to raise a child. Yes.
Thank you. But before we go into the discussion, let's first have a documentary on prematurity.
Babies born before 37 weeks or less than 2 kg body weight are not fully developed with their bodies, not ready to face the environmental challenges, and therefore require special assistance to adjust and thrive in the extrauterine life. About 1 of 10 babies are born too soon and prematurity, and its related conditions is the known leading cause of death and morbidity among the under 5 population. With global efforts and enhancement of premature care, increasing survival rates has been noted. However, with significant neurodevelopmental morbidities such as retinopathy of prematurity, hearing defects, cerebral palsy, among others. Compared to conventional premature care where kangaroo mother care is initiated after stabilization of the baby, immediate kangaroo mother care has been cited to reduce respiratory diseases, hypothermia, hypoglycemia, and infections, which are great risk factors to neurodevelopmental morbidities. The global theme for World Premature Day 2023 is Small Actions, Big Impact. Immediate skin-to-skin care for every baby, everywhere. Small actions have been cited to greatly improve the quality of lives for our babies born too soon. Together, we can create an impact.
Yes, Dr. Judith, you've had a documentary about 1 in 10 babies are born too soon. And we've had so many efforts put up across to improve their livelihoods, to reduce mortality. You know, prematurity is said to be the #1 cause of under 5 mortality in this country, and I think almost globally. And however, we put up so much efforts to make sure that we don't lose these babies. But we are seeing some of them living with complications, you know. And we feel with the theme of 2023, small impacts, small actions, big impact. What do you have to say? You've had a documentary.
Yeah, most definitely. First of all, I want to say a happy World Premature Day to
Yay. You know, prematures are my friends.
Yeah.
Yes.
Happy World Premature Day to all the caregivers of prematures. Yes, I know it's not an easy run. And just like what you pointed out, small actions, big impact. And as we could see what the documentary pointed out to kangaroo care, or would say kangaroo mother care, or kangaroo parent care, because now we're not necessarily only looking at the mothers,
yes,
but to any available caregiver. Though, of course, the pioneers would be the mother if they're the first available people. So we're looking at what are the small things that we can do that can actually create a big impact
to the lives of
these babies. And I think that's when I would come in and maybe define what kangaroo mother care would be actually from what was being described in the documentary. And this is skin to skin.
Before you go into definition, welcome to the Pediatric Voice, our dear viewers. You can tune in live, that is on GoTV channel 841 and 170, that is on free to air. You can also watch us live, that is on Bethany TV Uganda, on Facebook, YouTube, and X Spaces. Feel free to share, subscribe, call in your friends to watch and learn so much more about premature care. Now, that statement, Dr. Judith, small actions. I feel, I don't know, have we been doing just too much that was not helpful to these babies? What are those small actions? What do they mean, small actions that create big impacts?
So you could think of many things. You're thinking of what are the simple little things that we could do that create big impacts to these prematures, to these babies who are born, like you said, less than the 37 weeks. And like you said, are we doing too much? Are we over-fussing? Are we over-caring? And then we realized, how could we look to involving the caregivers, involving the parents, and without having to depend completely on the health force, because these are not really the connection that is going to continue even for follow-up with the prematures. So you look at things of kangaroo care, you look at things of nutrition, exclusive breastfeeding, you look at giving a healthy environment or a healing environment. How does the environment around these prematures look like? Is it noisy? Is it unstable? You look at things like how can we give them a good sleep, maintaining their sleep cycle. Those are the small things that can give us big impact. But currently one of the pioneer actions that are being taken place that is common to all of us, and I think globally, is the kangaroo mother care.
Okay, before we delve into kangaroo mother care, how important are these small actions? How are they helpful to our babies?
Yes. So we look at these small actions. I've tried to peruse through almost, they're like core, like 7 things. It helps these babies, keep them stable. It helps us get them out of the premature stage, growing well, reaching the actual growth that we want them to achieve. It helps prevent them getting the different illnesses that they sometimes get, the different sicknesses. And also, it's to the system, it's affordable. It's affordable, it's accessible, it's achievable, and everyone can be a team player.
So the FS, accessible, feasible, you know?
Yes.
Yeah, okay. Dr. Judith, we have 2 worlds of care.
Yes.
We have the first world and the developing world. So in the first world, they have the practice of let a baby be born, can be left in hospital, the parents can go and have their comfortable zone out there, visit their babies as long as you leave us with milk to feed the baby. Let the caregivers, the health workers fully take care of the babies. That is, I've seen it in several hospitals in the developed world and a few hospitals in our setting actually. And then we have the developing world where the parent is you know, is hands-on from day one. What is your comment? Is it feasible to have both parent and health workers, or it is, you know, the conventional practice of let's first have the health worker handle this delicate baby and then the parent can come in later?
Yes, so thank you so much for asking me that question. Like I had pointed out, like you talked about the AFAS, what is feasible in our immediate setting. So currently our setting, we are a third world country. So you'd want to look at it wholesomely. And also the fact that when the parents are involved, already having a premature is a stressing factor to those who are not professionally prepared. And usually it's something that comes suddenly. Most of the times the families are not ready to receive such news. So there is panic, there is fear. However, I would say that it would be nice that initially the professional caretakers take over the care of this premature as they counsel and move along with the parents. Because remember, we're also looking to early discharge, because these children also grow better when they're at their home setting. So we want to quickly involve the parents so that they can quickly be discharged, and we continue following them up from home. So of course you do get the panicking, the scare, the fear. So there's no one who's just going to get a premature and hand it over to the caregivers. However, we do look at involving the parents in this care. And you find that they're even better caregivers because they have that attachment and they'll be able to have that follow-up. So I would say that it has to go align. And like you said, since we're in the third world country, are we able to maintain this? Would we be able to maintain having the nurses or any staff take care of the child alone? Or would we be able to afford also having the parents involved? Because, or would we afford just telling the parents to take care of the child alone? Because you know the risks of that. So I look at us having more of a sandwich approach and doing a stepwise involvement of these parents. So
we, in other words, we need both the caregivers and then the health workers.
Yes.
Okay. Now, the theme for this year, small impacts. Sorry, small actions, big impacts.
Yes.
And the focus specifically for this year is kangaroo mother care or kangaroo parent care. You know, when we say kangaroo mother care, the fathers is like, there's no father in there, you know?
They're like, I'm fine, I'm good to go.
I'm good to go,
yes,
you know?
Yes.
And you know, we, by coincidence, most of the mothers that get to deliver prematures are actually unwell parents. They are either having a high blood pressure somewhere, a high blood sugar somewhere, or any other medical conditions. And sometimes the mother is even in the ICU. Yeah. But first, before we go into the causes of prematurity, you know, we've ever had a show. Actually, our inaugural show was about prematurity. We looked at the different causes of premature birth. For those of you that missed watching this show, please go on Bethany TV Uganda, watch Care of Prematures. Yes, it is there on YouTube. You can peruse through and learn the basic care. So today we are focusing on the small actions that can be impactful in the livelihoods of these prematures. So to begin with, what is kangaroo mother care?
So kangaroo mother care, I'll use the World Health Organization definition so that we can apply to the global audience, actually. Yeah, so this is prolonged skin-to-skin contact between the mother and the preterm for averagely 8 to the premature 8 to 24 hours, whereby this premature is put on the chest of the mama, of the parent. In this case, it could be the mother. But of course, the mother, the advantage that she has is that there is the breasts, which also help provide and also cuddle and give warmth as well. Yeah, but either whoever the caregiver is in this circumstance, like you said, maybe the mother is still in ICU and there is no one, we would still just say the chest of the caregiver. That is what kangaroo. And then also to include exclusive breastfeeding on its definition, yes. So you have a situation whereby the baby is on the mother's chest for prolonged time, average 8 to 24 hours, and is also engaging in exclusive breastfeeding.
So I'm picking something very interesting in your definition. The hours are important. You know, sometimes we tell parents to do kangaroo and then they come and do half an hour, an hour, 2 hours, and they feel my back is aching. So what is the adequate time?
Yes. So like I had phrased, like how I phrased World Health Organization, 8 to 24 hours. But no mothers are going to say, but is that really feasible? I'll have to move, I'll have to be on WhatsApp, I'll have to do other things. But again, it says you can do it individual based. So at least averagely for each session, it should take 2 hours. Our research showed that 1 hour is not really adequate to develop that growth and the different things that we're going to mention that we are looking out for. So each session should be 2 hours, but we're looking to a continuity of between 8 to 24 hours, where 24 hours is actually the whole day. So this is something that you would hope, if someone is able, can do it the whole day.
Okay.
Yes.
So is this process, kangaroo mother care, really necessary? Is it helpful?
Wow. Small actions, big impacts. So it's very helpful. One, it helps the mother bond with this premature. He starts getting this closeness to the mother. Two, it increases growth. You know, one of the issues we have with prematures is that they are small, they are tiny.
Yes, and most of them are less than 2 kilograms.
Most of them are less than 2 kilograms. And generally for the audience, for them, they just see a tiny human being. And sometimes they're like, oh, I'm so afraid, doctor, I'm so afraid to touch this baby. And of course, every mother's desire is to watch this child grow. And you can find by the small action of skin-to-skin contact, this child can actually gain weight more faster than a child who is not on skin-to-skin contact. It also helps increase the supply of milk. You find that the mothers who do skin-to-skin contact have more outpouring, more supply of this breast milk. And then also more breastfeeding, because sometimes you hear mothers saying, doctor, the child is not breastfeeding, the premature. But when you have skin-to-skin contact, he starts wanting to have the nipple, wanting to breastfeed, wanting to suckle. And you know, they already have that immature swallowing reflex, but through skin-to-skin contact, it develops faster. So the child who is on skin-to-skin contact is more likely to breastfeed.
You know, I love breastfeeding.
Yeah.
I love breast milk, and actually my patients know me for breast milk.
Yes.
So just pause right there.
Yes.
Dear viewers, we are discussing small actions and that can create a big impact in the livelihood of our premature babies. You know, this Friday, that is on the 17th November, we are celebrating the World Premature Day. And the theme is small actions, big impacts. That is, the focus is to reduce the mortality and the morbidity, in others, the quality of lives. We are not just focusing on the survival of the babies, but how are they surviving? Are they going to grow to full-blown human beings? We shall continue the discussion after the break.
Bethany TV for Health. Introducing Medical Minds with Dr. Andabati.
And these tubes can be so delicate that sometimes they get damaged. Some people have gotten the damage because they have undergone some operations. So damage to the tube system is one of the big problems we also do see.
The groundbreaking show that takes you behind the scenes of the medical minds.
You will explore cutting-edge treatment and technologies revolutionizing reproduction health.
Now, in retrograde ejaculation, we get damage to the junctional valves, which I could say.
Learn about the science behind fertility, contraception, and emotional journeys that several women trek.
Every Sunday, 8 p.m, live on Bethany TV. Yo TV Super App presents the Black Friday Trolley Dash. Simply subscribe to any of the bundles. When you subscribe for a month, you have 20 chances in the draw. For a week subscription, you get 7 chances. And for a day, you get 1 chance. The winner will be getting 200,000 shillings worth of shopping at Mega Standard Supermarket throughout November. The Black Friday Trolley Dash, proudly brought to you by Mega Standard Supermarket, Yo TV, and Bethany TV for Health. Ladies and gentlemen, we are thrilled to introduce Bethany Santa Omugabi, who will be sharing wonderful goodies with you this Christmas season. Getting a chance to meet Bethany Santa Omugabi is easy. Just tune into Bethany TV and get to know our various programs and talented presenters. Bethany Santa Omugabi will make surprise appearances during our live programs and offer Christmas hampers filled with an assortment of goodies, including healthy food items. When you spot Bethany Santa Omugabi during any of our programs, be the first to call in and say, "Hello, Bethany Santa Omugabi. I am your Christmas date." He will then ask you a simple question about our programs and presenters. If you answer correctly, you instantly win a mega Christmas hamper. But that's not all. You can also respond on social media. The first 20 people to respond to each question on social media will be entered into a draw. And lucky winners will be picked and announced during Bethany Santa Live on Saturdays. Bethany Santa Omugabi, only on Bethany TV for Health. Bethany TV for Health.
Welcome back from the break, dear viewers, and thank you for keeping it at Bethany TV for Health. Now, we are in for the Christmas season and a lot of goodies are happening. And guess what? Bethany TV has not forgotten you. We are bringing to you the Bethany Santa Omugabi, where he will be sharing, he will be appearing on your screen. Just keep watching Bethany TV, that is from morning to evening, and keep note of our different shows. So he will be appearing live on screen, and the moment you see him, call in. Be the first to call in and say, Bethany TV, sir, Bethany Santa Omugabi, I am your date. And immediately he will ask you a question. Imagine he will ask you, who's the host of the Pediatric Voice? Just say Dr. Helen Namsoke, and you'll be winning hampers and so many other goodies that come with it. Don't forget, just keep watching all the different shows of Bethany TV for Health throughout the day, and you win yourself a Christmas hamper. And today, this week on the Pediatric Voice, we are discussing the different small actions that can be done to improve the livelihoods of our prematures that can impact in reducing mortality and morbidity of our babies that are born too soon, that is the premature. And this is in commemoration for the World Premature Day that is happening just 2 days away from us. And today in our studio we have Dr. Judith Lubega, who is discussing mainly kangaroo mother care. And Dr. Judith, before you broke off, you were still telling us about the importances of kangaroo mother care, and one is was bonding, and number 2 was quick growth, number 3 we were still discussing the point of increased productivity of breast milk.
Yes, so you really want to emphasize.
I mean, how can a baby grow without breast milk?
You know. So yes, and you know, it's also rewarding to the mothers as well. It's rewarding, you know. That's how on graduation day, and you're like, I breastfed this baby with all I have, you know. Yes, so like I was saying, it also increases the supply, because like you talked about, it's very frustrating to the mothers psychologically, because every mother wants to have enough breast milk for her child. And then, you know, should I use formula milk? Should I get cow milk? So you find that with this kangaroo mother care, the skin-to-skin contact, the supply because of good hormonal letdown, is actually increased, and then the mother will have more available milk to give this premature. Yes.
Okay.
Yes, and then next that will also follow. This premature is going to be able to breastfeed more.
Because they're in contact with the mother.
Because they're in contact with the mother.
Oh, yes.
The premature is going to be turning left, turning right, searching, oh, where is this breast? Where is it? Where is it, mommy? Where is it? So you find that when the child is actually near you, the child is able to breastfeed more frequently. Because remember, caregivers were also looking to frequent breastfeeding with these prematures, because it also helps improve their growth. Yes.
Okay, thank you. So having seen the importance of kangaroo mother care, you know, now in our setting, I've seen it happen. There is the fear of the unknown when a family has a baby that is born less than 2 kilograms, especially less than a kilo. Some people have never seen somebody that small. You know. I've seen it. I personally take care of premature babies, and you call in parents to come and meet their baby for the first time. And with my experience, most of them don't want to come back and see the baby until after like a week. I had a mother who one time had a baby that was born about 700 grams, 700, 800 grams. And she told me she'll come back to see the baby after 2 weeks. The reason was she was scared. She had never seen a baby. She had waited for close to 8 years to have a baby, and she came out that small. And her experience of meeting her baby, beautiful angel, for the first time was
and
so
it's a 700
was so
grams.
scary. So I'm wondering, with this advocating process, how are we going to go about it? How are we going to convince our parents that someone that small can actually go into that chest that fast?
And actually, this is just to continue advocacy. And this is why we have Bethany TV with Dr. Helen. Because the more the mothers get to watch this, the more they're encouraged. I know they just say, oh, the child looks so tiny, and they're afraid to touch the child. But with our help and support, we actually guide you through the process. Because you see, it's very safe when you put that baby on your chest. It's the safest place to put the baby, because you just wonder putting this little tiny child on a bed inside a crib, and that's scary. And that's why we discovered and realized, what if we put this child right at the chest, at the heart of the mother? And you find no matter how tiny that baby is, you get more courage and more strength. And it can be a stepwise process. You can do the first time for 1 hour, the next time for 2 hours, then the next time you find yourself actually getting to 24 hours. And you know, like you said, Dr. Helen, there are many champions who can eventually give testimonies to these mothers of even more smaller children of 600 grams. At Kawempe National Referral Hospital, we've had 600 grammars actually making it, and we hope to eventually be able to share it with Uganda at large. So yes, it's really possible.
Okay. Are there disadvantages of kangaroo mother care?
Wow.
You know how we studied the merits and demerits of what? Is it all juicy?
Dr. Helen is asking me a trick question. She wants the medical fraternity to come for me, and they say, oh, she's discouraging a kangaroo. The demerits, Dr. Helen.
Okay, let me give you. Last week we held a show on sudden infant death syndrome.
Oh, yes.
You know, and I've personally, I've ever seen a baby die in kangaroo. I've personally ever. I've witnessed one actually die in a hospital, not at Bethany, but I've ever seen one die in a hospital setting. And I've also ever had a mother come to hospital having lost a baby during the process. So how, in other words, how are we going to help parents to make sure that this kangaroo mother care is actually safe for their babies? Okay.
No, I love it when you phrase it that way. Yes. So you're very right, but actually prematures are more likely to suffer sudden infant death syndrome than the term babies. That the children with lesser weights of less than 2 kilograms, with or without kangaroo, are more likely to suffer sudden infant death syndrome. And then also the technique which we undertake this kangaroo. That's why we say, no, we have to put the child to face on the side, so maybe the child is not suffocated. The nose is not suffocated in the middle.
In other words, the baby can face the parent, but
yes.
her head should be put on
the side. Okay. So some of the, like you said, yeah, some of the applications or the techniques that are used can lead to certain poor outcomes, like sudden infant death syndrome, or when the child is not well wrapped, sometimes they get to low temperatures, which we call hypothermia. And then also when the mother, like you said, is a bit afraid, because one of also the benefits of kangaroo care is that the mother is able to monitor the child. How is my child breathing? How is the heart rate? But for other reasons, maybe the mother is having low depression, or she's overwhelmed. You can find that some of these things are missed, and yet they may have been caught if the child was under the care of a professional health worker. So those are some of the demerits. But I like we said, when we continue counseling the mothers, taking you through, walking you through, receiving all the different questions that you have, it's you will not find such demerits happening commonly. It's very rare. It's not common.
Okay.
Yes.
Okay, so Dr. Judith, I don't know your experience.
Yes.
No, with my experience, parents are usually very scared of these babies.
Yeah.
And they are also scared, you know, the stress of we have to look for the money to clear hospital bills, the stress of having to stay in hospital longer, you know, and there's so many other questions they have at hand. Are they really ready to start on? Because before we've been having a week, almost close to, you know, usually the baby is stabilized between 5 to 7 days.
Yes, yes, yes.
That's when they're off CPAP, you know, and that's when we usually start kangaroo mother care. And here we are telling the parents that you can start off even when the baby's hours, or CPAP can go on even when the baby's in the kangaroo, in the chest of the caregiver. So I don't know, how are we supposed, what can we do to convince the parents? Do we have to go back to protocols? Should this information start pouring in right away from antenatal side, from the side of the gynecologist? Remember, we pediatricians get to meet these mothers when the baby is either about to be born or when the baby is already born. How are we going to, I know you work with you know, Ministry of Health, in a way, how are we going to streamline this information to make sure that it goes down, so that the parents are not, or the caregivers are not scared of these babies that are small?
I love the way Dr. Helen is asking me precious questions. Yes, most definitely we're associated with Ministry of Health. Yakawempe is Ministry of Health.
Yes.
Yes, and like you said, awareness. Awareness through such conversations at Bethany TV. And the Ministry of Health, I know, is watching and listening and hearing that, yes, we have to start right from antenatal care. What happens, mama, if you get a premature, if you get a preterm? And also picking out the risk mothers. There are those mothers that are specifically at risk for getting preterms. Those are those with multiple pregnancies. By that I mean maybe twins, maybe triplets. There are also those ones who have had assisted delivery, like maybe a conception, like maybe IVF. Then there are those who have had a premature before. There are those who are maybe having chronic diseases like hypertension or maybe cardiac diseases. So usually with antenatal care and through the gynecologists, we pick out these at-risk mothers, then also have the pediatricians talk to these mothers, explain to them what to expect, explain to them, like you pointed out, how can we save? Which hospital would be best for our current financial status if we got a preterm? And not just necessarily talking about the gynecological part of it, the obstetric part of it, but also talking about the baby, because the baby is the final product, and that's what every mother wants to see, you know, a healthy baby. So I think that that's what we should do.
That is actually a very interesting point. You know, there is no man, how is that saying? No man is an island.
Yes.
So the gynecologist should not focus on the mothers alone.
Yes.
So they should, what I'm picking from your conversation, the high-risk parents, they should invite us as soon as possible. I think maybe as soon as 20 weeks.
Yes, yes.
So that we get to talk to these mothers and prepare them for the eventualities.
Yes, yes, yes.
Begin the hard talks.
Yeah, hard talks, yeah, you're right. It's a hard talk to have, but it's a necessary talk to have, because like you said, the more prepared the couple is, the more they're able to handle it. Because like you had pointed out, no one expects to have a preterm. But now that we have actually had many years of improvement of the outcomes of preterms, why don't we actually say, but what if you do get one? What would your financial state be? What would your support system be? Family members who could come and assist you, you know, in taking care of this child? And what could you be?
Actually, now on the point of the support system, before you continue,
yes,
I'm looking at this mother that has had triplets, and maybe she has had an emergency cesarean section because of high blood pressure.
Yes, yeah.
Or whatever reason, and she has ended up in the ICU. And then this father has bills of 3 babies to clear, plus the bill of the mother who's in the ICU. So he has to go to work to look for money. So in other words, they need other family members to come up and help in these early small actions that we need them to be involved.
Yes, you're very right, because I always look at a situation, we can raise money for maybe a wedding, raise money for different functions. We can also raise money and support from our social support system for taking care of this child. You don't have to be a martyr. You can cry, actually you can cry out for help, you can ask for help. Because like what I'll continue emphasizing, and what Dr. Helen has also emphasized, it's very stressing for a couple to have to embrace having a preterm, but it's very possible for this child to come out, grow very well, and be an astronaut, a pilot. I don't want to say a doctor because I'm a doctor, an engineer.
No, they should also be
they should, and they'll be the best ones, because you know they have really benefited from the system.
Okay, having looked at kangaroo mother care, who should do kangaroo mother care?
Wow, wow.
Yeah,
wow.
Who should be involved?
Chance the word to come out of my mouth. Honestly, technocratically, the mother is always the first option, because she has the breast milk. And we thank God he knew why he made it that way. But should for any reason the mother is unable to do kangaroo, for example, maybe there's some infection on the chest, maybe came through an accident, or the mother is unconscious, or
she has back pain.
Or she's even back pain, doesn't have to even be that much. Yes, so the fathers can take part in kangaroo. Sisters can take part in kangaroo. Neighbors can take part. There was a time my mother had quadruplets.
Yes.
And there was a nearby nurse who actually had to come in the kangaroo, not really a family member. So it can be anyone who is willing and who the parents have accepted to be part of the system.
Okay. So in the drop ward, they have what they call domiciliary services, where the health workers, the mother is discharged from a health facility with a nurse to go with at home to help care of this baby that was born too soon. Now, a few families can afford that even here in a setting, and I've personally had an experience of a parent, you're about to discharge them and is like, can I get a nurse, you know? But we know the biggest population, more than 95%, if not even 99% of our population cannot afford domiciliary services, and if anything, they're not readily available in our setting. Do you think this immediate hands-on can be helpful to the families that can't get rich of the domiciliary services?
Yes, to continue encouraging the caregivers, like Dr. Helen has pointed out, Averagely having a bedside nurse is between 50,000 to 70,000 shillings per day.
Yes.
That is very expensive. So I'm looking to you immediately starting this skin-to-skin care, is that so that by the time you're released from the hospital, you have the confidence to take care of your little one. Because it's now not only about the fact that can you or can't you, it's about you getting the strength to be able to take care of this premature. So if we start immediately the child is born, put the child on skin-to-skin contact, when you go back home, you're going to have the confidence, and the fear of being with this child alone will not be so much. And then also, like we said, having the key caregiver who's going to support you around much more faster. Vis-a-vis, oh, it's 1 week into the hospital, let's look around the whole child, or who is going to be able to support us just in case you're tired. So the faster we start the kangaroo, the more you're able to see what challenges you're going to have, and the more you're going to be able to understand what support system you can have, and also be able to take it on yourself. Yeah. Okay,
Dr. Judith, apart from kangaroo mother care, are there other small action a caregiver out there can get involved in that can be greatly impactful to the life of a premature?
Of a premature, yes. Breastfeeding.
Or breast milk feeding.
Breast milk feeding. Breast milk feeding exclusively. Not having mixed feeding as much as possible, because we cannot overemphasize the benefits of breast milk, not only to the preterm but to children at large. Helps them prevent diseases, helps them grow fast, helps them bond with you. So that's something, small action, big impact. Then also partnering as a couple, we try to point that out. Fathers also being involved. You know, sometimes the mothers, like she said, are very stressed, very depressed because of having this small little one. And then you know how we have the men, they are stronger, they are tougher. So, you know, small actions, big impact. Rub mommy's back, you know, get her a pillow to rest on while she's doing this kangaroo, get a comfortable chair. Then also we talked about the environment, simulation, calm, smooth music. I know, Bethany, the next show you're going to tell us examples of what the music can be. Small, smooth music, small actions, big impacts. And then also, yeah, sleep cycle. I don't know if we can point that out. If we give this child a predictable sleep cycle, because when we maintain the type of sleep that they are having, it helps them also grow. So it's a small action, but it has a big impact. What time do you want this child to sleep? When do you wake this child up? It's a bit too much for the time we have left, but that could be something that we could delve into. How should my preterm sleep? And then also minimizing stress. For example,
people usually say they don't get stressed, they can't feel pain. Some people even want to carry out procedures on them without analgesia.
Now she has pointed out something. There is an assumption that the preterms or even babies don't feel pain because they can't express pain. So we're looking now, it has been found out through research, to minimize stress and pain. And we do this by, for example, you talked about handling. If you want to handle this premature, handle them as much as possible at once. Don't go and pick the child up 7 times to do 7 different things. Try to make sure that the one time you're touching the child, you know what you're going to do. You do it in a systematic way, then put the child back. Not, oh, I've forgotten this, or I've forgotten that. That actually has been found to bring stress. And then for certain procedures, sometimes we give prophylactic analgesia medication. What is recommended and is enough is what we give them. We don't assume that, no, they don't need anything. Yes, so we're managing pain and we're managing stress.
Okay, Dr. Judith, thank you very much for that wonderful discussion about the small actions that can create a great impact in the lives of our prematures. In a minute, what is your take-home message?
Yes. So my take-home message is Small actions, big impact. I think kangaroo mother care is something that's small, it's affordable, it's accessible. Every one of us can do it, and it can create such a big impact. Your premature is going to grow. Your premature is going to smile back at you. I know some mothers, I guess, I can't wait until the day I can define this child's smile. This premature is not going to have many infections. This premature is going to bond with you, and you're going to be able to get enough breast milk that you can have. So I encourage all of us, mothers, health caregivers, even the media, to continue advocating for kangaroo mother care for the prematures. Yes, that's what I'd give them as my take.
Thank you very, very much, Dr. Judith. Now, dear viewers, thank you for watching the Pediatric Voice and for tuning in this Wednesday, where we've discussed the small actions that have greatly or can greatly impact the lives of our babies that are born too soon. Personally, with experience, I take an example. When a baby is born, of course, a lot is going on, especially in the first hours of their birth. They are struggling to breathe, you know. They are cold and so much. But imagine being put under a warmer or incubator where a constant temperature is set up for them. And, you know, it is the machine warming them up. And sometimes it warms up the core body, and then the feet and the hands are left a bit cold. So the baby is not warm enough. And, you know, studies have shown that if the baby does not get adequate warmth, is likely going to break down their little body fat they have, to try as much as possible to generate it. They are susceptible to infections. They are susceptible to lose more surfactant, that is the component in the lungs that is very, very important in their breathing. So in other words, we shall end up calling you in to buy a surfactant, which is quite very expensive. And, you know, when the baby is within your chest, they are getting that, you're helping them with a variable body temperature according to the environment, because you as an adult, you can maintain a very good temperature and make sure that the baby is warm. And it also helps you, like she earlier said, bond very well with your baby, so that you can easily connect. It makes you stronger and get a chance to get a hands-on with a baby. You can easily notice something that is not going well with your baby as compared to anyone else who does not have that strong attachment with a baby. I've personally had a chance to transport babies in kangaroo, and those that have not been transported in a kangaroo, and I can tell you there is a great difference in the outcomes of these babies. Those that have been transported in kangaroo reach much safer and have had a better outcome, a shorter stay in the hospital, and so many advantages. In other words, kangaroo mother care is the way to go. Small actions. It is not expensive. It is very cheap, easy to do, but very, very impactful in the lives of our little ones. That is it we had this week on the Pediatric Voice. Till we meet next time.